12 real causes of swelling and lymph stasis in the body. Today you will understand why you have swelling and stagnation of lymph in the body, how swelling and cellulite are related to stagnation of lymph, and by understanding the cause of swelling and cellulite, you can easily get rid of them. So watch this video to the end. Before we move on to the 12 real causes of swelling and lymphostasis in the body, I suggest you understand what is lymph and the lymphatic system. Lymph is a clear fluid that connects cells, tissues, and blood vessels, that is, arterial and venous blood. Lymph delivers nutrients to cells, transports a nutritional function, removes toxins, microbes, foreign particles, and products of cellular metabolism from the intracellular space, detoxification or barrier function. Lymph is responsible for protecting our body from pathogens, immune function. The human body contains up to 4-5 liters of lymph. Lymph flows within the lymphatic vessels. Along the course of the lymphatic vessels are lymph nodes. In the lymphatic nodes, there are immune, that is, defense cells of our body. They destroy pathogens, bacteria, fungi, viruses, toxins, and even tumor cells. Thus, lymph nodes prevent infection from spreading throughout the body and localize it in one place. The lymphatic system refers to all lymphatic pathways, namely lymphatic vessels, trunks and ducts, lymph capillaries, and lymphoid organs. Lymphoid organs include, for example, lymph nodes, spleen, bone marrow, thymus gland, as well as lymphoid tissues in the gastrointestinal tract, that is, lymphatic or Peyer's plaques in the small intestine, and in the pharynx, pharyngeal tonsils, lingual tonsils, and palatine tonsils. The total mass of the organs forming the lymphatic system is about 5 kilos. Lymphoid tissue is found in many organs and tissues. The greatest accumulation of lymphoid tissue is in the digestive tract, and this is completely understandable. After all, together with food in our body, lots of bacteria, fungi, worm eggs, and other parasites get into our body. Symptoms of lymphatic system dysfunction. I will name the symptoms of lymphatic stagnation, and you will immediately note which of the symptoms you have. Swelling, loose skin, cellulitis, bags under the eyes, bad breath, mucous knot in the nasopharynx, frequent tonsillitis and adenoiditis, skin rashes, unpleasant body odor, excessive sweating, enlargement of cervical, submandibular, axillary, and inguinal lymph nodes, subfebrile body temperature 37-38 degrees Celsius, decreased immunity, autoimmune diseases. With stagnation in the lymphatic system can begin with varicose veins of the legs and pelvic veins and even hemorrhoids. The movement of lymph occurs due to several factors. First, the contractile activity of the lymphatic vessels. Second, the presence of valves inside lymphatic vessels preventing the reverse flow of lymph. Third, pulsation by nearby blood vessels. Fourth, movement of the diaphragm. Fifth, suction action of the thorax. Sixth, muscle contraction. And seventh, normal posture. So what prevents the normal flow of lymph? Let's move on to the analysis of 12 real causes of swelling and stagnation of lymph in the body. First, disturbances of the digestive system. The intestines and liver are necessary for the normal functioning of the lymphatic system. The intestinal walls contain a huge number of lymph plaques and lymph capillaries. When food enters the intestine, the lymph capillary pulls in nutrients, water, fats, and simple sugars. And while there is no food in the intestine, metabolic products from the tissues and lymph nodes of the intestine can be discharged through the lymph capillary into the lumen of the intestinal tube. The liver produces more than 50% of the body's lymph, and its regional lymph nodes act as peripheral filters that purify the lymph produced in the liver. Second factor, tight, uncomfortable, constricting clothing. Tight clothes such as tight skinny jeans, tight underwear squeeze the tissues of our body, preventing the normal outflow of fluid from the intracellular space in the lymph capillaries, venous and lymphatic vessels. This leads to edema and disturbances in the microcirculation of blood and lymph. Third, period, disturbed posture, curvature of the spine, osteochondrosis, protrusion and herniated discs lead to disruption of the nervous regulation of vascular tone and skeletal muscle tension. Squeezed and narrowed vessels are not able to ensure the normal outflow of fluid from the tissues, which causes swelling. Cervical osteochondrosis, improper head position, broken bite, and even improper position of the tongue in the mouth can lead to facial swelling and the appearance of the second chin. Yes, the second chin very often appears because of tissue swelling, not because of fat deposits in the area of the lower jaw and neck. In this case, cosmetologists with their injections of lipolytics will not help you. On the contrary, they may even harm you. Fourth, clamped spasm diaphragm. Blood flows through the blood vessels due to the work of the heart, and lymph flows through the lymphatic vessels thanks to the diaphragm. That is, the diaphragm is actually the heart of the lymphatic system. The largest lymphatic vessel, thoracic lymphatic duct, passes through the diaphragm. The wall of the abdominal part of this duct is fused with the right leg of the diaphragm. In this case, during respiratory movements, the wall of the thoracic duct is compressed and thus lymph is pushed further. The clamped spasm diaphragm restricts the flow of lymph through this large lymphatic vessel. Fifth, an unbalanced diet poor in protein and electrolytes, potassium and magnesium. If we lack protein, then fluid is retained and disturbed unevenly. This causes swelling of the extremities and abdominal bloating. Lack of potassium and magnesium leads to a violation of water electrolyte metabolism, to the retention of fluid in the intracellular space, and as a consequence, the appearance of edema. Sixth, problems with the cardiovascular system. Increased blood pressure may be associated with a disease such as atherosclerosis. When the level of cholesterol increases, the walls of blood vessels thicken and thicken from the inside. Plaques form inside the vessels, they narrow the lumen of the vessels and interfere with the normal blood circulation in the organs. Seventh, stress, increase in the level of adrenal hormones. During prolonged and severe stress, the body begins to produce large amounts of hormones such as cortisol, adrenaline, noradrenaline, and aldosterone, which directly affect mineral metabolism and therefore fluid retention. Eighth, problems with the urinary system. If the kidneys and bladder for some reasons are unable to remove waste products and fluid from the body, if urination is difficult, water begins to accumulate in the body tissues. Ninth, hypothyroidism. This is due to low functional activity of the thyroid gland. Thyroid hormones affect our metabolism. Our metabolic processes depend on the rate at which they occur. There must be a balance. Thyroid hormones are proteins that act as metabolic rate regulators in the body. When they are insufficient, metabolism slows down and the whole body swells. 10. Low water intake and high carbohydrate intake. 1 molecule of sugar retains 4 molecules of water. Therefore, reducing carbohydrates, especially simple sugars, simple carbs, leads to less swelling. Surprisingly, if you drink less water, you will swell more. All of our body's biochemical processes take place in or involving water, so lack of water causes a state of stress in our body. 11th, insufficient physical activity, that is hypodynamia. Skeletal muscle contractions help in the active outflow of venous blood and lymph, promoting the movement of fluids through the blood vessels. Sitting in an uncomfortable posture for long periods of time, constriction of vessels in the knee and hip joints, lack of contractions of the leg muscles, all this leads to stagnation of lymph and edema. And finally, 12th factor, chronic sluggish inflammation is often found in people who are overweight and obese, insulin resistant and immunocompromised. This is because in such people with these conditions, various toxins and inflammatory factors are activated and increase the permeability of the vascular wall. By the way, the production and activation of inflammatory mediators occurs also in allergic reactions. In fact, allergy is an immune reaction of the body, accompanied by damage to its own tissues. Allergic diseases are based on different types of allergic reactions. If you'd like me to expand on this topic in more detail, let me know in the comments below. If you have swelling, cellulite, overweight that you don't know what to do about, ask me in the comments below this video. In the next video, I will give you super effective lymphatic drainage exercises. Take care of yourself. Your Dr. Zarifa Romanova.